Welcome to the Prime Health Podcast with your host, Dr. Derek Barron. Dr. Barron interviews doctors, wellness experts, and healthcare leaders who are revolutionizing how we approach health and longevity. The Prime Health Podcast explores breakthrough science, personal and patient stories, and practical insights that are shaping the future of health and wellness. So sit back, listen in, and prepare to transform how you think about your path towards Prime Health with Dr. Barron and his special guest.
Welcome back to the Prime Health Podcast. I'm your host, Dr. Derek Barron. I'm here to bring you cutting-edge insights and practical strategies from leading healthcare experts for your journey to Prime Health in life and in business. Now, here's a bold idea in healthcare. Good to great primary care should solve most problems before you ever need to see a specialist. And today's guest, Dr. Sarah Parsons from GoodMed Clinic, combines relationship-based medicine with functional insight, providing amazing healthcare and results for her patients. Now, before we jump into this episode, I want to hear about it more just like you do. Just a quick sponsor from our message from our sponsor, Growth Solutions, where we believe every healthcare professional deserves an exceptional growth partner to match their ambition and help their practice grow in its potential. Now, Growth Solutions takes a diagnostic approach to your business. We analyze where there may be time, money, leads, or opportunities that might be leaking, and we look for a way to fix them. Whether it's new patient or client acquisition, marketing and growth strategies, reducing operational chaos, or yes, implementing same AI and those robots because they're coming for us, whether we like it or not. So if you've ever thought this to yourself, I'm too busy to grow, too slow to scale, or too overwhelmed to fix it, we are your solution. Just drop the word free below and you can get a growth consultation if you like, or reach out to me on any of the social platforms. But you're here for a reason, and that's to hear from our amazing guest. Dr. Parsons, welcome to the Prime Health Podcast, and please tell us a little bit about yourself and what you do.
Thank you, Dr. Barron. I'm happy to be here.
Yeah.
So I am a naturopathic doctor practicing direct primary care out of Seattle, Washington. I have 2 kids and a cat, and we have a lot of fun exploring the Pacific Northwest in our free time.
It's a beautiful part of the country. I'm not that far west, but I'm in Idaho, so it's adventure every day when you're out there.
Oh, yeah.
So that's great to see. I do want to ask the question, and that I ask it of everybody. Was there a moment in life, or where there's a reason, a circumstance, anything like that chose you to have a career in medicine?
Absolutely. Well, there was a moment where I decided to follow naturopathic medicine.
Okay.
Prior to that, I always knew that I wanted to be a doctor. I used to, as a child, play pretend that I was a doctor in the backyard, but I would do that with leaves and berries. And so as I grew and went into the pre-medical track, I became really disappointed by the amount of time that conventional providers were able to spend building relationships with their patients, and decided to look for something different. So that led me down a path to discovering naturopathic medicine, which brought me full circle to those memories playing in the backyard with leaves and berries. And it allowed me to kind of marry all of those interests and build a career out of it.
Yeah, love it. And we had shared this before, being from the Midwest. I remember in my backyard, the little wintergreen berries that I'm always still looking for those. You squish them, smell it, or you eat them and taste it. But that, I don't know what medicinal effect it has, but I sure love seeing them. And the spring came around when they were there. So I'd love it if you could explain kind of the unique difference of what direct primary care is and how that's different than somebody may see a physician in the hospital.
Yeah. That's a great question, and one that I'm still working on articulating very well, because it's such a new concept, or it's a relatively new concept.
Okay.
But under the conventional care model, you go see a doctor for your primary care, either in a hospital system or just in a larger system. Out here in Seattle, one example would be Swedish, right? And so a larger system that employs many different doctors, along with nurses and care teams. That relationship between yourself and the provider at that location is mediated or controlled by your insurance plan. So how much time you can spend with them, even who you get to see, can all be determined by your insurance plan. People often run into bottlenecks in terms of getting into their provider, getting their concerns addressed by that provider. Often there's a limit to only being able to bring up like one, maybe two concerns per visit. And you might only get 10 or 15 minutes with that provider maximum. Communication is also really challenging. You might send them a message and it might take days before you hear back, weeks sometimes even, or you hear back from a different member of the care team instead of the provider themselves. So it's care, it's available, and a lot of the time it's really good care, but it's not accessible. And that's one of the most important distinctions between the conventional care model and the direct primary care model. Under direct primary care, you are working directly with your provider without the insurance being the middleman that's kind of controlling the relationship. And so under our model, we have a membership model. It's a month-to-month subscription, and that gets you access to unlimited visits, unlimited communication. I give you my direct phone number. You can call and text anytime, 24/7. And it really helps foster a deeper relationship between the provider and the patient. One that is, relieved of the anxiety of like, oh, is insurance going to cover this visit or not?
Yeah. Yeah. It's a great point. Too often people are relying upon their insurance to help them with their health. It's that ugly word, health insurance, was added in front of there, where it is insurance if you need it, but it's not the best way for us to address our care. Mm-hmm. We should have a relationship like you're speaking of, Dr. Parsons, where if somebody needs to speak to their physician, like the old days, the bump clinic where I was at, where you could reach out to your doctor and speak to him or her. So it's a great model from the direct primary care practice that you offer as compared to that. And another point that you brought up earlier is, I think it comes down to a timing issue. Mm-hmm. Unlimited, hopefully people don't call you at 3:30 in the morning unless it's a true emergency. But the truth is, when you would go into standard care, 7 minutes isn't enough. When somebody would come to your office, let's say I come to your office as a new patient, kind of go through a little bit about what that initial consultation could be like.
Mm-hmm. Yeah. So for me, an initial consultation usually runs about an hour, sometimes an hour and a half. During that time, where we spend most of the time just talking. I like to sit down with people and hear their story. And for some people, especially people living with chronic health issues, that story's a long one. And so we'll spend that amount of time really just kind of dumping it all out on the floor and sorting through it together and organizing the information. If there's time, I'll also make sure that we tick off some boxes that we would want to include in like an annual exam, making sure that preventative healthcare measures are addressed. But given that it's direct primary care, if we don't get to it in that visit, that's okay. We can do it again. They could even come back as soon as tomorrow and it wouldn't change their billing cycle. I really mean unlimited visits and communication. So that time pressure of like making sure that we get to all of this, within a certain prescribed amount of time, is relieved.
Yeah. And I think you're hitting on an extremely important point in that, there's a doctor-patient relationship, whether it's the DPC model or primary, care in a clinic at a hospital setting, but the relationship changes because of the access that you have. But I think it really changes because you said you can come back tomorrow or it's unlimited. That's what a great way to build trust with your provider.
Mm-hmm. Yeah. And to really do people's stories justice. Because for so many folks, they have so much going on. There's a lot of layers to get through. And even that 1 hour visit is often not enough time to really get through all those pieces. And so it allows me to really wrap my head around someone's care and not just focus on like one small subset of their symptoms and start to build towards getting to the root cause.
Yeah. All right. You just hit a good word, root cause. I hear that a lot when it comes to functional medicine, direct primary care for that. So what is your root cause approach to primary care with your patients?
Yeah, that's a great question. Often illness, especially chronic illness, comes out of a combination of lifestyle and history factors. whether that be, chronic disrupted sleep, chronic lifestyle challenges, whether it be, difficulty building an exercise routine or difficulty in navigating the really like complex and confusing world of nutrition, which shouldn't be so complicated, but we have so many different conflicting opinions about what good nutrition looks like.
Yeah.
That those factors can come together and create a like chronically ill and inflamed picture that can take some time to unravel and unwind. I also find that like gut health can be a really important root because if we're not digesting and absorbing our nutrients properly, it's very hard for the rest of the body systems to really function optimally. There's also I also do a lot of mental health focus because like the mind body connection is so important to me, and what we're finding in the research and in real life is a lot of chronic health issues are related to traumatic experiences and histories. So, finding the root cause looks different for every person. And I make sure to take a step back, because of the amount of time that I can have with people and the deep relationship I can have with people. It allows me to be able to take a step back and look at them from a whole person perspective, taking into account everything that's come before, everything that's going on now, and really piece things together in a way that in other settings I wouldn't be able to do.
Yeah. It sounds exactly what everyone would want in their own healthcare, right? Time with your doctor, the ability to explain everything. Oh, wait, I forgot something that might add to that. Relaxing in there, getting a fresh start with somebody, all those things that probably aren't working. And I kind of said at the start of this is that there are too many people going in conventional medicine that get 7 minutes. They're not really sure when's the next time they can get them back in, 7 or 8 weeks from now. So just, they said something about their gut. Why don't I send them to a GI doc? So the question comes back to you. How does somebody know if direct to primary care is good for them? And I guess if I piggyback on that, why is it better to see a direct primary care physician like yourself versus immediately get pushed off to a specialist?
Specialists have their role. They play very important roles. I am very, very grateful for all the specialty opinions that I have received and worked with. And I have a lot of patients who are also really grateful for that. But there are a lot of chronic health issues that get referred to specialties that specialties don't really have the time or the energy to manage. Like one example would be chronic constipation, falling under the GI issue. A lot of people would get referred to gastroenterology for management of that, and they do a good job with it. But they also are busy with caseloads that also involve like, more severe conditions like IBD or Crohn's, or, goodness forbid, like digestive cancers. And so I really see myself as, potentially relieving that pressure off the specialty to manage, conditions that really can fall under the purview of primary care and allow them to focus on the really, really complex cases that they are best suited for. Now, why would an individual benefit from direct primary care rather than being, handed off to different specialties? One is all of your information is in one place, and you're working with someone who knows the other parts of your story. A specialist is only going to look at this one part of your story, and they might really know a lot about this one part of your story, but they're not able to see the whole context. They also don't have the time or the attention span to really take that information in. And so what I aim to do, both to benefit the patient and the specialist, really is to bridge that gap and be that person who can really holistically look at everything. And then, following the direct primary care model, we just don't have the distraction or the limitation of trying to work with insurance for primary care. I think insurance is great for emergencies, for those specialist consults, right? For things that are more like one-off situations or extreme situations. But for your everyday care, working with insurance for a lot of people ends up creating more barriers than it solves.
Mm, okay. Yeah, it's a holistic approach. It is a functional approach as you do within your practice, and it gives people that fresh start again of because we've hopefully it won't be that case, but we've all had that experience where I'm just a number going into the office. And yes, of course, even in a DPC practice, they're a number, but it's a number with time, a
Mhm.
big difference in how you do that. And I really like how you say that when they go to the specialist, they focus on that one thing. You know, from the story of minute one to minute 59 in your conversation that, you know, at 30 minutes, something they brought up can affect that, which how we would care for them. There just isn't the way for them to do that in a typical hospital or clinical setting.
Mhm. Yeah. No, the system really isn't set up for that. And it's unfortunate. I mean, because I know a lot of providers, a lot of specialists, they're in this field for the same reason that you and I are, because we wanted to help people. And I know a lot of specialists and providers who are really frustrated by feeling that they are working, they're helping people, yes, but most of their time is spent trying to navigate the machine of the healthcare system instead of really dedicating their energy being towards caring, which is really what they came here to do. So
Yeah.
I feel very fortunate that I can.
Yeah. Good for you. Well, I'm sure your patients are a benefactor of that as well.
Mhm.
So, in your practice, Dr. Parsons, at the Good Med Clinic, what do you say is the differentiator for you versus somebody else in the community? What do you do better than others in how
Mhm.
you approach healthcare?
Um, that's a great question. You can see the like my Midwest like humility, like it getting triggered here,
It's okay to brag.
because
It's okay to
um, but I mean, there are things that I am very good at. One is relationship building. I mean, that was one of the biggest reasons that I went into this field in general. The reason I went into the medical field and then went into naturopathic medicine was really because I wanted to have strong relationships with my patients.
brag.
Um, and that's something that I really, strive to do and really value in the care that I provide. And so it's about the relationship. It is about the holistic and functional approach, and that lens, applying that lens to your primary care, helps to foster really good outcomes, both in preventative and in like healing and recovery. Um, so if I had to say, it would be those things.
Okay, love it. I appreciate you sharing that. So, who would you say in your community would be an ideal patient that would come in to see you?
I really enjoy working with families quite a bit. I did a residency that was pediatric focused, and I really enjoy working with kids. I also, kind of following along with the prioritization of relationships. I love working within a family system and being a family doctor. It's been really valuable for me to be able to provide optimal care for the whole family by seeing all the different factors that are affecting each person within the family system.
Okay.
So an ideal patient would be a family. Kids have their unique needs. I often work with a lot of parents, and particularly mothers who are battling hormonal issues. Perimenopause and hormone replacement therapy is a huge part of what I am doing these days, along with managing gut health and recovery from conditions like small intestinal bacterial overgrowth, SIBO, and other similar conditions.
Yeah. Have you seen an increase in certain conditions that present, whether it's mom, dad, brother, sister in the family, or in general, are you seeing more commonalities of certain conditions coming into the practice?
Um, a lot of allergies, um, a lot of hormonal issues. Like I said, perimenopause is a big one. Um, Cardiovascular health,
Mm,
and for kids, allergies and eczema. I see a lot.
mm,
Hmm.
yeah,
So it kind of
unfortunately.
runs the gamut.
Yeah. Yeah, it does. It covers it. And you did say that you work with some mental health conditions as well. Is that a part of the practice? Yeah, from a family perspective as well?
Oh yes, absolutely. And thank you for bringing that up, because yes, I would be remiss not to mention the fact that I have yet to meet a single human being who hasn't dealt with some anxiety or depression or other mental health condition at some point. And
Yeah.
so it's always a part of my evaluation and care is to make sure that like we're checking in on mental health pieces. But I also
Yeah.
do work with a lot of people with neurodiversity,
Oh,
which is it's it's kind of a hybrid between like a neurological and mental health um, um, set of conditions. But I have a lot of people with ADHD who are on autism spectrum who are exploring those diagnoses. And it's been really wonderful to be able to um, be the guide in someone's journey as they are learning about themselves in that way and finding what works for them.
yeah. And I'm sure that's very helpful because parents are lost sometimes as to what to do with their children if they kind of fall on that spectrum.
Mm-hmm.
Um, and if they're not deep into the spectrum, they're just, they're realizing that their child, it's not that it's unique, but they have certain characteristics that they're not sure how to help them and calm them down.
Mm-hmm.
And I'm sure being primary care, having the ability to work with the family and then building enough trust with the parents and the children for everybody to have a conversation in the clinic.
Mm-hmm. Yeah, exactly. And particularly for people who are neurodiverse, having a familiar home base for their care, with a familiar person, where they have clear expectations about what to expect, goes a long, long, long way to creating a sense of safety and stability in accessing care. I'm particularly thinking about some of my kiddos who are on the spectrum who like really need that like predictability in order to feel comfortable.
Yeah. Yeah.
Mm-hmm.
You don't have to just share if it's somebody that's on the spectrum, but do you have a success story that you'd like to share with us of a patient that's come in and how you've changed them from probably being in the typical medical model to when they have found you in your practice?
Oh, I mean, so many. It's hard to think of just one. But there have been many occasions where people who have, and this is, separate of our previous conversation, but like honestly, like the biggest impact that I see is financial and people who move from conventional care to direct primary care. I see so many people who have just been like encumbered by medical bills,
Mhm.
laboratory bills, imaging bills, like visit bills, hospital bills. And when they find their way to direct primary care, and I tell them that their labs are going to be $20, and maybe their MRI might be a maximum of $300 when they just got done paying off the $6,000 one,
Yeah.
um, that's when I see the most tears of
Mm.
frustration and also relief.
Yeah.
And where people really are the most inspired.
Mm.
But yes, also like with the functional medicine lens, I have seen a lot of people say, "Oh my gosh, I have never met a doctor who listened to me the way that you did. I have never had anyone make as much of an impact in my health as much as you have.
Mm.
Um, I feel like a completely different person after coming here and trying what you have suggested. These are things that I never tire of hearing, and yet I hear it often.
Yeah. Well, that's a sign of a good physician. So good for you. And the truth is, good for your patients that they get to experience that and start to get good and true healthcare,
Mhm.
not just what their insurance dictates to them that they can afford. So I
Mhm.
appreciate you sharing that with us.
Mhm.
From the business and the practice perspective, what are you focusing on right now in your business?
Mhm. Right now, I'm focusing on spreading the word. There are so many people who don't know about direct primary care, who don't understand it, um, who don't even realize it's an option, both like as a patient and as a provider, because how many providers are just also drowning in trying to navigate the insurance model?
Yeah.
Um, I am really excited to share this with people and share how much of an impact this model can make, especially as we all are trying to survive the healthcare system as it is. Would I also love reform eventually? Like, of course, but this is where we are right now. And direct primary care is a really good solution to where we are right now. Um, and then we are accepting new patients. Both Dr. Ryan Campbell, who's the clinic owner, and myself are actively accepting new patients. So of course, like, we're always thinking about growth and making sure that we're able to welcome as many people as we can help with this model.
Love to hear that. It's important. In the Pacific Northwest, anywhere out there, people need options. And I think with what you were saying passionately, you're giving them a great option, a great care in that regard. So for your practice, again, what do you see? What's the vision of your practice in the next 3 to 5 years?
In the next 3 to 5 years, we really hope to grow. Really hope to grow in terms of our access, our reach, and our ability to deliver care. We currently have a little under 500 patients between the two of us, and we have the capacity for a lot more. So, so yeah, that's the focus: spreading the word, helping more people, doing what we love.
Yeah, good. So I'll share all of your links for the social contacts so people can learn more about you and follow you and see what you do, and follow you on TikTok and things of that sort. But if you would like someone to be able to reach out to you, what's the easiest way for them to connect and contact with you?
Yeah, I recommend going to our website, goodmedclinic.com. Through that, you're able to schedule a meet and greet with myself or Dr. Ryan if you ever wanted to have a one-on-one. Our direct phone information and my email information is also on there. Those would be, among the best ways to get in touch with us.
Okay, perfect. I'll make sure that those are in the description below as well. Two last questions for you, Dr. Parsons. If you could give us one piece of advice that would affect our health in a positive way, what advice would that be?
Get better sleep.
Expand a little bit more on that, because I'm listening with both ears, I promise.
I wasn't sure how much time we had. Yeah. So if I'm ever not sure where to start, I usually start with sleep, because having poor sleep quality or poor sleep quantity has such profound downstream effects on every other part of the system. It negatively affects immune system function, energy levels, recovery. It triggers salt and sugar cravings. If you're sleep deprived, your body will crave salt and sugar like crazy. Try it. Go a half night of sleep and see how it affects you. I mean, don't actually, but if you're not sure, you can. And so that's usually where I will begin, because as soon as we can get people sleeping better and more deeply, the other pieces will fall into place much more effectively.
Yeah, I like that. Salt and sugar cravings. I'll have to see what happens if I get maybe an additional 30 or 40 minutes of sleep tonight. We'll see if that changes for me. So
yeah.
Last question for you, Dr. Parsons, would be, you're a guest on the Prime Health podcast. What is your definition of Prime Health?
My definition of prime health is a state where all systems are flowing together. The mind, the body, the muscles, the GI, the nervous system, everything is functioning well and optimally and communicating well. And that translates into a lived experience of someone who is feeling vital, resilient, excited about life, ready to take on challenges, someone who bounces out of bed in the morning, or maybe at least like gets up with some enthusiasm. That would be prime health. And that state of being can be achieved at any age.
I like that. Gives me hope. I just turned a year older a few weeks ago, so I'll take note of that for sure. Well, Dr. Parsons, thank you so very much for being a great guest on the podcast. You've got a unique perspective. Of course, I love the Midwest connection. How could I go wrong? Even though we're in the Pacific Northwest, I do love the Midwest connection with you, Michigan, myself, Wisconsin. But I think what's unique is you had a dream, at least being a physician when you were little, using the medicine in the backyard and the garden and wherever you were at, that you were thinking, I need to do things with berries. I need to do things from a health perspective. And you carry that on, and you chose naturopathic as your path. And I think that your patients benefit from that. Now, as you're out in the DPC arena, where it's direct to primary care, you have the ability of sitting down there knee to knee, talking with the patient and the family, as that's what you like to see, and really getting to the root cause of their problems. So I appreciate you doing that for them. And I always say this for the viewers and the listeners that are here. If you heard what Dr. Parsons had to say, if it affects you in a positive way, you know there's at least one other person out there that you should share this with. We would love for you to share with as many as possible, but at least just share it with a friend or a colleague that could find this useful in their practice or in their life. So I would appreciate that. Selfishly, I always ask that you subscribe to our podcast. We'd love to get more subscribers and be able to share the great message that we do. But until next time, remember that true wellness is a journey we are all on together. Whether you're taking charge of your own health or guiding others in theirs, every step forward matters. So please do stay committed to your Prime Health journey. Again, Dr. Parsons, thank you very much for being a great guest on the Prime Health podcast.
Yeah, thank you so much. It was a pleasure to be here.